There we go. Hopefully everyone can see the screen there, H5N1 update and developing biosecurity protocols. That's the topic of the webinar today. Again, my name is Ricky Telg with the Center for Public Issues Education. I'm also part of the outreach core for the Southeastern Coastal Center for Agricultural Health and Safety. And it's our pleasure today to bring this topic to you. We have three speakers who will be presenting information on H5N1. We have Ben Anderson with us today, as well as Colleen Larson and Cindy Sanders. All of them have different aspects to talk about with H5N1. Ben will be providing an update, and Colleen and Cindy will also be providing information about the Florida Extension's role and responsibilities and response to H5N1. So Ben Anderson is an assistant professor in the UF Department of Environmental and Global Health. Colleen Larson is the regional dairy extension agent, and Cindy Sanders is the Alachua County Extension Director here in Alachua County. So Ben will be speaking first. He will have information about an update from the last time he had a webinar back in November-ish. And then he has a place where he needs to be at 11 o'clock. So while he is speaking, if you have a question specifically for Ben, please put that in the chat. I will be facilitating and monitoring the chat questions and comments throughout, but he will have to leave a little early. So if anything specifically for him, please do that. He will respond to the questions that I will be providing to him that you have mentioned. And then we will go next to Colleen and Cindy. So with that, I'm going to stop my sharing of my screen, Ben, and I'm going to turn it over to you. Please also keep in mind at the end of the presentation, we will have a link to the evaluation for today's webinar as well. So that will come at the end. So Ben, it's yours.
Great. Thanks so much, Ricky, and thanks everyone for joining us today. As Ricky mentioned, we did a seminar back in November. I want to refer you to that. Today, I won't be talking about the virus itself and some of the biological details about what H5N1 is. However, if that's information that you're interested in learning about, I would encourage you to go on the website for the Southeast Coastal Center for Ag Health and Safety, where they have the previous webinars archived, and you can take a look at that. And we did a deep dive on what influenza A virus is, H5N1, etc., which is very helpful in understanding its epidemiology. Today, I'm just going to focus primarily on what's happened since that last webinar that we had around November, and some of the key updates, including what are the epidemiological data and numbers looking like right now, and what I call key epidemiological inflection points. So basically events that have happened over the last several months that are significant to pay attention to, that we need to understand why those events might have happened, because it gives us an understanding of the dynamics of the virus, the infection, and how it might continue to impact the various different sectors it's impacting now and into the future. So a lot of people can track this or have been tracking this online, but what I've done is I put all of the links to the data sources in these slides. These slides will be sent out and made available to everyone on the webinar, and so you can bookmark those links and be able to access that information so that you too can track the data. Much of this is still coming from the CDC and the USDA, though there are a couple other data sources now available that have been very useful. What we are seeing is continued periodic incidental cases of human infection. Most of our cases from last year of H5N1 in humans were associated with dairy cattle outbreaks that were taking place in the states, various states that you see highlighted on here, and then also that I'll show you with the livestock data update. And what we noticed last year with the infections in humans, thankfully, all of them were predominantly mild cases that were associated with exposure in these dairy farms and thankfully resolved. However, we do have some changes in the types of human infections that we are now seeing over the last couple of months. And I'm going to focus on that specifically towards the end of the presentation. We are continuing to see an extensive amount of detection in wild birds. In fact, we're also getting reports of a number of different wild bird die-offs in different parts of the region. This is a time where wild birds are continuing to move and migrate across the country and across the globe. And so this is one of the main transmission pathways that we're observing H5N1 actually getting into the country and moving about in the country, wild birds serving as the vector for the virus. So because of that, we get a lot of corresponding outbreaks among other susceptible animals along our migratory bird flyways. And this is true also for poultry. And so we have a surge of poultry outbreaks that, again, I'll dig down into a little deeper in a couple of slides. But again, general data here showing that the poultry outbreaks are, again, happening along primarily these migratory bird pathways. And that's essentially how the virus is getting into the poultry barns for most of the cases that we're observing, though it's not the only way that the virus is spreading. We also know that the virus is spreading sometimes from farm to farm and maybe some other routes of transmission. However, what we're starting to see and really starting to experience a noticeable impact, particularly in the consumer market, is a number of the larger farms. You can see here over 3 million birds last week in Ohio, a very large operation of commercial table egg layers. This is not the only one. There's been a number of very large operations now hit with H5N1. And some of the more concerning features of these outbreaks is that these operations have invested substantially in biosecurity measures, and yet the virus is still getting into the farm. So we have a real issue here where there's maybe some pathways of transmission that are happening that the biosecurity may not be preventing completely, and so we're still having vulnerabilities within these operations for incursions to take place. We are also still continuing to see cases of dairy herds showing up positive. This has been predominantly more so relegated to the western part of the United States and California, Nevada, and Arizona. It is a situation that, unfortunately, epidemiologically, we're starting to see maybe a potential move towards endemicity, meaning that the virus is not just happening with incidental infections, that there's a sustained transmission that's actually taking place within these environments. I think we're still not completely sure, as we are for other environments, including poultry, what the exact transmission dynamics are for the outbreaks that are occurring, though we have a better understanding that a lot of the virus is being moved around potentially from fomites or contaminated equipment and/or people who might be moving from farm to farm. Again, a biosecurity issue where biosecurity protocols could be implemented to reduce those potential movements or incursions from those situations. But again, we're I think still not sure if there's some other pathways that might be playing a role as well. So there's some question marks there. And then some concerning information that's come out recently about mammalian detections. We're still continuing to see the virus detected in mammals, but more recently, we've seen detections in some new species that haven't been previously identified to have H5N1, including some rodent species such as the black rat. There's been some hypotheses around one way the virus could be also moving from farm to farm, particularly farms that are in close proximity, could be animal transmission or animal reservoirs, and rodents could be a potential way that happens, though we're limited on the amount of actual data to be able to understand whether or not that's a transmission pathway that's of concern. But we are now detecting H5N1 in a number of those species. Coming back to the human infections, as I mentioned, the majority of the infections that were identified in humans last year were associated with dairy farm exposure, primarily raw milk exposure. And more recently, unfortunately, we saw our first severe human H5N1 case that happened in Louisiana. This individual, unfortunately, did pass away. They were older. They did have underlying medical conditions, which likely exacerbated their infection. But the difference of this case is that this individual was exposed to the virus through backyard poultry, their own backyard poultry. And so they were handling some dead poultry that were infected with H5N1, and that's how they that's how the virus transmitted to them. So the other thing that we've been paying close attention to, and something that I want to highlight on this call to explain and make very clear, is that the H5N1 that was circulating in the dairy farms and continues to circulate in the dairy farms was caused by an H5N1 virus that had a particular genomic feature or a genomic sequence, and we classify those as different genotypes. And the genotype that was circulating or has been circulating in the dairy farms predominantly is a genotype known as B3.13. And that's been unique to the dairy farm environment. That virus got into the dairy farms and continued to spread. And most of those human cases were a result of the B3.13 genotype. There's another genotype that also is circulating in the US, and that's the D1.1 genotype. That's the genotype that's predominantly circulating in the migratory birds and has what's been causing most of the poultry outbreaks that we've seen to date. Up until this case in Louisiana, none of the human infections were caused by D1.1 genotype infection. However, after sequencing was done, this case was identified to be caused by that particular genotype. And why that's a concern is because this genotype has been associated in the past with more severe infections in humans. So historically, that's been the case. So if we see more transmission or more human cases of D1.1, that would be a concern epidemiologically and clinically, that perhaps we're probably going to see some more severe presentations clinically of that infection. As I mentioned, we've had surge and egg layer outbreaks, but this also has been caused by the D1.1 genotype. And this has been impacting the egg layer industry over the last several months substantially. Again, large operations being impacted. And a lot of this is driven with the total loss of the flocks. The reason that that's happening is because the policy in the United States is following the USDA approach, where when a flock is infected, any chicken at all in that flock is infected with H5N1, the policy and the strategy is to cull the entire flock. And so it's called a stamp out approach. In the past, it has been very successful in mitigating H5 outbreaks. However, because the virus is so ubiquitous, this is causing, again, a large loss of egg layers and meat poultry whenever that method is being used, particularly when the operations have large numbers of birds in the flock itself. Coming back to the D1.1 genotype, one of the more concerning epidemiological events that has recently happened is the identification of the D1.1 genotype. Again, this is the strain that's mostly circulating in the migratory birds, was detected in a bulk milk sample in Nevada, and it was traced back to dairy farms in Nevada, and has also been recently associated with a human case that was infected with D1.1 with exposure to dairy cattle. So this is a huge shift away from what we've seen with the B3.13 transmission. That virus has been circulating within the dairy farms, and that's where it's been moving from operation to operation. D1.1, presumably in this case, we would say perhaps it was coming actually directly from migratory birds. And if that's the case, and we have that happening on a continual basis, then it changes the risk, particularly for our dairy farms, that the risk of transmission is not just a potential farm-to-farm introduction of the virus, that potentially the birds could be carrying it and introduce it into the farms as well. So it's something that we have to pay very close attention to and track with surveillance to see whether or not this continues to be the case. And the prevalence of this occurring, if it increases, would again raise our concerns about a new introduction pathway into farms other than just farm-to-farm transmission. I provided this here. This is more of a technical brief. For those of you who want to look at this, it actually has very good information about the investigation that occurred in Nevada. This was actually part of the national milk testing strategy that has been implemented in a number of states where outbreaks in dairy farms have occurred. And I just wanted to highlight that the strategy actually has proven to be very successful in that it's identified this virus in the bulk milk testing and has been able to do the trace back. And we're going to continue, hopefully, to see utility in that strategy. However, I know there's some potential challenges of how to implement that in different states and what that might mean for farmers. But I think it's at least positive that we've been able to see some good epidemiological data coming out of that testing strategy. One other thing I wanted to mention is that a couple weeks ago, this graphic showed up out of the CDC and was then associated with a paper that was published in the MMWR that was indicating that perhaps there was a potential for feline to human and or human to feline transmission. This has been in the news recently and covered in the press, and the paper is listed here. And what this paper was describing is that there was an investigation done in May of last year, so quite a bit ago. And the investigation involved looking at cats that developed neurological symptoms in a home, in two homes where people who were working in dairy farms that had H5N1 outbreaks ongoing lived. And in the homes, when they were investigating this, in one of the homes, there were also adolescents in the home that developed respiratory symptoms. The cats did test positive with diagnostics for H5N1, so that has been confirmed that those cats actually were infected with H5N1. And so the question was, where did they get it from? Did the workers bring it home and transmit it directly to the cat from person to cat? Was it an indirect exposure, perhaps with contaminated clothes or boots or something that was more of a fomite? Unfortunately, because of limitations in testing in this study, it's difficult to say. But all we can say is that the virus did end up making its way somehow into these two homes, but how that occurred is very unclear. And so the emphasis of the conclusions here is that additional types of study are very needed in these cases where people might have been exposed and or have symptoms of infection to understand if there are risks associated with potential household transmission to others or other animals. And then coming here to the end, I mentioned again this D1.1 genotype, which is really the story right now that we're following. The recent cases, there's been 3 recent human cases. I mentioned already Nevada, where the D1.1 genotype was identified in a dairy worker and was positive with infection with the genotype there. But we've also have 2 other human cases, one in Ohio, which was a commercial poultry exposure where an individual was working to depopulate a flock and became infected with D1.1. And then another concerning case in Wyoming where an individual was infected through backyard poultry, once again, similar to Louisiana, and also was infected with the D1.1 virus. And the information that we're concerned about out of these cases is that sequencing data has been published recently and has shown that the virus has some mutations in it that are associated with more efficient virus replication in mammals. And so again, the sequencing surveillance is an important part of our epidemiological approach to understand, is the virus adapting, and is it adapting in a way that's going to create more concern for potential human to human transmission or larger outbreaks among different animal species. And so again, something that we need to continue to watch very closely. And then I'll draw your attention to yesterday, hot off the press, an op-ed that was published by the newly confirmed USDA Secretary Rollins in response to the surge of outbreaks happening in egg layers, a potential promising response on the government side with a $1 billion potential investment from government support that has 5 pillars that they've identified focus. One is to increase USDA biosecurity assessments through a pilot program called the Wildlife Biosecurity Assessment, in addition to increasing the amount of supplement costs that they're going to cover for improving biosecurity in farms that need to increase certain things in biosecurity assessment plans. The second one is $400 million increase for indemnity, which is a very welcomed pillar to increase and mitigate the financial losses for the farms. $100 million to explore vaccines and therapeutics. I'll talk about that in the next slide. And then reduce regulatory burdens and potentially expand backyard poultry operations. I'm not really sure what that means exactly. It's not detailed, but we'll have to pay close attention to that to see if that turns into a more structured plan. And then considering the temporary importation of eggs to reduce the price of eggs at the supermarket. Coming back to vaccination, this is a big discussion right now in the poultry industry. Historically, vaccination has not been done in poultry because of concerns around trade agreements that certain poultry, particularly meat poultry that are vaccinated, are not permitted to be sold in certain markets overseas. And so there's a discussion coming back to that now and wondering whether or not the stamp out method for the USDA, as I mentioned, is actually the best approach to take. And so more discussions happening now around poultry vaccination, particularly in the egg layers. And there has been a poultry vaccine recently given conditional approval by the USDA, but whether or not that's going to be used, it's not clear yet. That's still going to be an ongoing discussion. And then lastly, the same discussions are happening in dairy cattle, whether or not vaccination would be a good strategy. In this case, it probably makes more sense because trade agreements are not necessarily a concern, but there might be some other concerns associated with the approach. But there are vaccines being developed, particularly a few that have received essentially the technology of the vaccine being approved, but they're working out the actual formulation and have to be able to test that in order to show efficacy. All right, with that, again, we'll take some questions today, but if you ever want to reach out to me, I've had a number of folks that have done so, and you have other questions, I'm always available by email. You can always contact me there or find my profile, and I'm always happy to discuss particular situations with folks or respond to questions that you might have associated with epidemiology of H5, whether in the state or the Southeast region or the US or even globally. I'm happy to do so. So thanks so much.
Thank you, Ben. As I said before, Ben will have to leave a little before our webinar time actually ends. So if you have a question specifically for him, please go ahead and type that in the Q&A. I apologize earlier, I had said chat, but in the Q&A, because he's going to have to leave in just a few moments. We do have one question from Pat. Said the question is, did dairy cattle get H5N1 from birds? And if so, what was the path? If not, where did it come from?
Yeah, so we actually have a really good phylogenetic analysis last year that was published on this. It is most likely that there was what we call a point introduction. So a one-time spillover of the virus from the birds into the dairy cattle. However, when that happened, the strain had some mutations in it that created what we now call the B3.13 strain. So it came from birds originally, is what what was most likely the situation, but has adapted in that case to dairy cattle to be more capable of infecting, particularly the mammary glands of the dairy cattle.
Kelvin has a question. Says, what approach is typically taken on dairy farms when the D1.1 genotype is traced back or found in their cattle? Did they use a similar stamp out protocol like with the chicken flocks?
Yeah, this is a great question, and thankfully, no. The stamp out method is not used for dairy farms, and the reason is because when cattle are infected, they don't die as often. It's actually a very low mortality rate whenever dairy cattle are infected. And so in that case, it's support and care and treatment of the animals, also isolation in the farms to mitigate spread to other animals. And then afterwards, those animals can be, if they're healthy, can be reintroduced back into the normal operations. However, we have seen some secondary issues with cattle that have recovered from infection, so maybe that they are not able to produce milk in the same way. But the stamp out method is not used in dairy farms like it is in the poultry. And one more thing I'll say about the poultry, one reason that stamp out is used is because the virus is incredibly lethal to poultry. And that has been historically always the case. And so whenever any bird within a flock gets the virus, within 24 to 48 hours, you're going to see the entire flock start to die because of how lethal the virus is. Thankfully, that's not the case in the dairy cattle.
Great. And that's all the questions that are in the Q&A, Ben. Let me just say this. If you do have any other questions for Ben, he's been very, very open to respond to questions. I don't know if anyone has sent anything to you directly, Ben, but there's nothing else here in the overall Q&A. He will be happy to work with you. If you didn't get his email address or other linking information here, please let me know, and I will definitely get you connected with Ben in the future. So Ben, thank you very much. You can stay on for as long as you're able to do so. I know you've got to head to another engagement in just a few moments, but I want to turn it over to Colleen Larson at this point. Colleen is the Regional Dairy Extension Agent, and then we'll hear from Cindy Sanders after that. Colleen?
All right, thank you, Dr. Telg, and I appreciate the transition from Dr. Anderson into kind of the status in the dairy industry as he was talking. I thought of some of the same questions that came up that I thought I really probably should have started with on how this does potentially affect dairy farms, even though we have not had any cases of avian influenza on dairy farms in Florida or most of the Southeast, with just that one case in North Carolina being the closest one that we've seen on dairy farms. So just a little in addition, this isn't on my slides, but a little in addition to what he mentioned on it not killing dairy cows. It really seems to be dependent on the environment. So it affects dairy cows much more substantially when they're heat stressed or under any other type of stress, just like you would expect any other pathogen or immune situation. If a cow's under stress, it affects them more. It causes a severe decrease in milk, and it's easily detected because the milk changes substantially to a very thick and discolored milk. So it is easily detected on a dairy farm when cows have it, allowing them to segregate those cows and move them into a hospital situation where they can receive therapeutic treatment or be culled if that is the case on those animals that may not make a recovery. Varying levels of respiratory and GI symptoms, mostly diarrhea, have also been seen on dairy farms across the country that have dealt with this, that are, again, just treated therapeutically. And so I say all this to say, we know what's going on in other farms across the country, but, what are we doing here and what's already being done to prepare? I can't get my slide to go forward. Why won't my slide go forward? There. Oh, sorry, too fast. Okay. So that just kind of moves into where we are now, what we're doing on dairy farms, what's already in place, the changes that, that we've made in dairy farms with the anticipation that this is something that we may have to deal with in the future. Some of the challenging points, how dairy farms are unique, and how that creates a challenge when thinking about what happens when and if this gets here. And then moving forward, what are the solutions and potential areas that we can improve and address to prepare? So just a little background on the dairy industry. Dairy cows are monitored heavily on a dairy farm. They are housed mostly in freestall barns, which is close contact with each other. Confinement from the stance that they don't leave and they don't go out onto grazing facilities. That's mostly for the status of, or for the reason of controlling their environment, heat abatement, feeding them. They're a lot more managed than a situation like a beef cow that's out on pasture where they don't see people as often. So the positive of that is people see them multiple times a day. Cows are usually milked 3 times a day. And so the status of that cow is evaluated on a regular basis. The picture of these cows that I've included on this slide also show, I'm not sure if you can see where my mouse is here. Other monitoring things that we do with cows that help us keep track of their health events. So when and if this happens, it is something that will not be an unknown on a dairy farm. We know right away when something happens, and dairy farmers are used to dealing with outbreaks of things that cause mastitis, and in that attempt to control those, they do have pretty effective procedures for stopping an outbreak, especially something that is contagious. So within the parlor setting, cows are cleaned and disinfected prior to every milking and post milking. Within the parlor, several disinfectants are used, both on the cow and on the facilities on every milking and in between shift basis. And furthermore, when they are detected to have a disease, especially mastitis, those are oftentimes cultured to determine the exact pathogen and how best to treat that. Another thing that has been done routinely and has also kind of been beefed up in this situation is the movement of animals. So whether animals are moving on or off the farm for various purposes, those animals routinely do not cross paths with lactating animals. They're in a off-site location, and the ability to segregate those animals for the length of time that might be recommended for biosecurity really depends on the situation. A lactating animal can't be indefinitely segregated, especially at a high level of production, because she has to be milked, 2 to 3 times a day for her health. So really that segregation time depends on that. Visitors and vendors routinely have their own processes for how they come on and off the farm. I will say that during this, that has been much more limited. So I participate from the extension standpoint in a lot of tours and bringing people on and off farms, and that hasn't been completely stopped, but it has certainly been limited. And we've also provided farms with additional resources to give instructions for visitors and collect information when they're on and off the farm, and worked with other vendors and industry people to do the same. Another area that's been implemented is designated kind of uses for equipment. So we have multiple feed delivery. We use thousands of tons of feed every week, and so that's a lot of vehicles on and off facilities, and we've worked with several of the delivery trucks to either clean and disinfect in between deliveries or have designated trucks that only service specific farms or specific regions, just to kind of limit that potential spread. And then monitoring is, kind of the next step to know when and if this happens. We've had several farms that have started the process of going through some of the enhanced biosecurity plans through the National Milk Producers Federation program that really kind of evaluates weak places of a farm and where they could increase those biosecurity practices that will potentially help with the spread of it, or the infection, or that disease reaching the farm. So I'm working with three farms currently where we are monitoring sending milk samples for monitoring every week. And thankfully, those have all come back negative, but it will be a quick, process when and if that happens, that we will know when it gets here. Some of the challenges, as Dr. Anderson mentioned, is the lack of information about how this is being transmitted from farm to farm. I put dairy experience on here because farmers talk to each other a lot. And sometimes they share information and sometimes they don't. Dairy farmers from Texas, California, Arizona, they have been very willing to share their experience with other farmers here. And varying levels of biosecurity practices didn't seem to, in their experience, didn't seem to make that much of a difference of whether or not they got the avian influenza when it was within a certain proximity to their herd. And, so that creates a challenge for how farms are, going to prepare and try to get ready for this if it gets here. Some of a challenge with some of the recommendations when this started, a year ago now, the biosecurity recommendations that came out from the CDC and the Secure Milk Supply. Some of them were quite unreasonable. If you've ever worked outside in, with cows in Florida in the middle of summer, wearing what looks like a full hazmat suit isn't safe for employees, or anybody, working in those environments. So kind of balancing those biosecurity recommendations along with what is feasible and makes sense and is safe for employees and animals is definitely a challenge. The preparation for the treatment, they've, like I said, shared with other farms about things that have worked and what hasn't worked. The preparation for really shifting the entire herd focus from their normal treatment and care and reproduction and those activities to basically providing therapeutic treatment for infected cows, identifying infected cows, and then the decision making of which ones are able to go through that recovery requires a huge shift. And it's kind of, in my mind, akin to what we go through during hurricane season on a farm. It is just a complete shift from normal operations, which in any business is, a challenge to go through. Communicating, we have multiple agencies involved from FDACS and USDA, and just making sure that everyone is on the same page through this monitoring and what happens when and if there is a detection. So communication is another area that is a challenge. There's a lot of things that could go in there. People, whether it's people working on the farm or vendors, are a challenge. You can ask them to do certain things before they come on a farm, but the inspection and regulating of that is very difficult to put into place. I mentioned timing. The sentiment across the dairy industry is that if you don't get this when cows are under heat stress, it's not so bad. If you do get it when they're under heat stress, it's very difficult for the cows to recover and work through it. The movement of animals, I already mentioned. Sometimes we have the ability to do that more where they can be isolated for longer, but with a lactating animal and with space limitations, there's only so much that can be done with isolating animals and moving them away from the rest of the herd. Wild animals, Dr. Anderson mentioned a lot of the places where that's showing up. I've worked with some dairy farmers who have tried to find ways to, discourage wild birds and animals from being on the farm, but there's a lot of limitations to that, especially with the protection of migratory birds, both, the state and federal status of those. So other than, just using some of the discouraging methods, there's not as much that, they can do to keep them off farm. And that's always been a challenge for other pathogens, but is certainly more of a challenge now. Within the biosecurity recommendations, there's this line of separation on facilities that farms have been trying to figure out how to manage that. And with as many supplies, including the feed and milk moving on and off the farm, along with people, it's really a challenge to create that line of separation that has been more effective in the poultry industry, with just the essentials going on the farm, and the infrastructure of a dairy just doesn't support that quite as well at this point. And then who is responsible, for what? The early recommendations of biosecurity measures actually had pictures of people leaving their trash and their PPE on a farm after it was used at a farm, and just having some more realistic expectations of how to go on and off a farm to both help make sure that we are not spreading things, but also not adding additional work and problems at the farm whenever people are on and off the farm. So those are all some areas that are, a little bit of a challenge, but hopefully, there's a solution moving forward. And some of those solutions obviously will be continuing with the biosecurity plans that cover the treatment of cows. I didn't really mention some of the biosecurity things that we do with young stock. There's a lot of young stock that are not raised in Florida. And so that is another avenue of animals that go to Texas or Kansas or, to the Midwest to be raised, and they come back. So isolating those animals and having procedures to, bring them back into the herd after they have been identified as healthy to come back in. And then continuing to educate employees and the industry to support biosecurity measures and make sure that the buy-in is there for everyone to be part of the solution. I know Cindy's going to get into more of the exhibition and when we're making plans for that. Thankfully, we have had successful dairy shows throughout the state so far this year, with monitoring and testing prior to the shows and evaluating the animals when they come back. And we're glad that that has been able to to continue. And then obviously the continued research to find more answers about how this has spread if it gets here, how it's being transmitted, and then obviously, the next steps of protecting animals through vaccination, and then continued monitoring and finding the best ways to treat cows for this, potential outbreak and other health issues in the future to support them therapeutically. So, like Dr. Anderson said, this is not a mortality event by and large for dairy. So while it's a huge concern, thankfully that's not what happens with dairy cows. The pasteurized milk is safe for people to drink. So, the milk from cows who are infected is easily detected. They're pulled out of the herd. The pasteurized milk is safe to drink. That's been established and shown over and over. So while it is a huge concern for the dairy industry, it's not, quite as dramatic as it is for the poultry industry. But we realize that, the virus can change and become more devastating, and, are looking forward to some of the solutions to help all of our livestock industries, prepare and recover. So with that, I hope I didn't go too far over. And
No, that's fine, Colleen. Thank
Okay.
you very much. And we'll go ahead and transition to Cindy as well. We'll have time for questions for you and for Cindy and Ben, as long as he can hold on too. So please continue to type in any comments or questions in the Q&A. I just want to say a personal thank you to Cindy, who is extremely into the fair season right now. She's actually has the Alachua County Fair starting today. So we're very thankful to you to make time this morning on this very important and timely discussion about biosecurity plans for local fairs. So Cindy, it's all yours.
Okay, thank you, Dr. Telg. I just want to say I'm Cindy Sanders. I'm the livestock agent here in Alachua County. I also am the interim extension director in Bradford. So we start Alachua County Fair today, and then I go to Bradford because we overlap. We had State Fair 2 weeks ago, which I also serve on the Florida State Fair Board Authority, and worked with them pretty extensively. But thanks to Dr. Anderson, I have an intern this semester, Isabel Revere, who is a master's student in public health and one of Dr. Anderson's students. And she started this project in January and has hit the ground running. So I give 99% credit to Isabel, my intern, for helping us. As extension agents, we work closely with our local county fairs, and some of us, like Colleen and I, work closely with the Florida State Fair. So I think it's important, and we thought it was important enough to develop a biosecurity plan for our local fairs. We hope that this biosecurity plan will turn into a template for other fairs as well as state fairs to use. We have worked closely with Florida Department of Ag, of course, and our inspectors at all of our local fairs. I have shared this plan with our local inspector, Robert Capote, who is also here in our office. So I'm just going to, first of all, figure out how to advance my slides. Oh. Purpose of this framework was to basically help fair staff. We all have fair boards in our counties or at the state fair to execute a biosecurity plan that prevents the induction and spread of diseases. And I'll just say this, we should have had this a long time ago. Whether it's zoonotic diseases or it's COVID or it's an act of God with a hurricane or a tornado, all of this framework really puts together who we contact, when and where, and what is our plan. So the goal is to implement biosecurity measures that hopefully will prevent diseases as well as other environmental effects. So why is it important at our shows? Well, we know that we want to try to prevent outbreaks. We're commingling all these animals, whether it's poultry, beef cattle, dairy goats, meat goats, chickens, rabbits. We're commingling all these, so we're worried about that spread between, if it's zoonotic, a spread between humans and animals, but also the spread between animals is important too. You know, most kids, youth, 4-H and FFA, you take an animal to a fair, they come back sick. Well, they've been in contact perhaps with another animal at the fair that had respiratory diseases or other diseases. So I'm going to jump right into the plan, what we've developed, and we're going to work after we get through with fair season here to put this up as a publication for other fairs to use as a template. So basically, why I said this was important, because we've never had all this together in one place. Most of the time, everybody comes to me as the extension agent and want to know how to get in touch with different people. So we have it all together. This has been shared as of yesterday with our fair board, and our fair starts this afternoon. So that if we have an emergency situation, we know who to contact. So I think creating this communication channel is important for everybody involved in the fair: youth, fair board, FDACs, your county folks, social media, your media. All this is important, because if we did have an outbreak, we want to make sure we've got a plan. So the first thing that's on the plan is, what species do you have there? You know, do you have dairy cattle? Do you have poultry? Do you have rabbits? Do you have chickens? The next thing we're looking at is off-site businesses that may be at your fair. Vendors, do you have a petting zoo? Again, this is all important. We're going to try to keep food separated from our animals, which is sometimes hard with youth, but that's in our plan. Again, this is just we're just going to try it. We'll know. I can tell you next week how it goes. Biosecurity and pathogen risk. When we develop this plan, we want to keep in mind what current outbreaks are out there. Right now, we're looking at avian influenza. Next year, it might be something else. Hopefully it's not, but you never know what's going to be out there. So it could be E. coli, swine flu, listeria. All these things are important when our livestock come to a fair and they have that public interaction. It's always important to educate those people involved. A facility map is important, where the public's entering, where the youth are entering. We want to try to keep the public away as much as possible. I think we've done a good job at State Fair of having lanes where public can go, and then we have our exhibitor lanes, which are actually amongst the livestock. So it's important to consider your fair layout. These entry and exit protocols are important. Ticketing, if some of you all have ticketing at your fair where there's a carnival involved, you want to make sure you have plenty of signage. Trailer parking, if trailers are left on site, is important, because we know that manure are in those trailers. We want those in a designated area. And we've thrown around this idea of public entries and exhibitor entries. Do we have foot baths? Do we not? Who's going to clean them? There's a lot that goes into that, but definitely hand washing stations, hand sanitizer. We have that outside the state fair where the barn is, where all the animals are. And I think that's important. We're going to try to limit food and drink in the animal barns at our fair. Again, that's sometimes a difficult task with kids, but again, we're going to do our best. In the visitor plan, we have how many visitors do we normally have? We're going to have clear walkways with signage on where the public can walk and where exhibitors. We also have signage for exhibitors about making sure they're washing their hands and making sure we don't have perhaps food in those areas. And we're also going to have, my intern Isabel is going to have an educational booth for the public that comes to the fairs. We talked about this earlier. I think it's important that our public get research-based information and not what they hear or see on the media or Google themselves. So that's important to educate our public. For our 4-H and FFA exhibitors, we have sent out a pre-fair survey yesterday, and we also sent out a pre-fair checklist to all of our poultry exhibitors based on what Florida Department of Ag has sent us, making sure those animals hadn't been around any sick animals and that kind of thing. It's kind of just a declaration that those exhibitors say yes or no. Prior to the fair, we have distributed this biosecurity plan to all our fair board members as well as our youth. And so this is just a few of the questions that we have in that for the exhibitors. Are health certificates required? What species? Is there any testing that's required of the animals, and when that and where that has happened? So this is just kind of a pre-fair exhibitor survey that's gone out. Today we started, so we have check-in at the fair. Where are those areas going to be? This year we're going to do a little different with our poultry. Normally when poultry come up to get bled at check-in at the fair, they're all gathered around and you've got 30 birds all waiting to get tested. Well, we're going to try to keep those birds separated and keep them in the vehicles until it's time for them to be entered, just in case, fingers crossed, you know, we have a bird that looks sick and have the symptoms, then we don't want those other 30 birds around. So we have all of this in the plan as well, as far as offloading, how they're entering the barns, and are there cleaning stations for there to clean their equipment and boots, which we will have that. We'll be washing down and sanitizing the wash racks on a daily basis. So again, this is all new, but we're gonna give it a shot. And this is just talking about wash racks and where they'll be where they're located and what's going to be used to sanitize those. So then post fair, for terminal shows, we want to know what animals are terminal, what animals are going home, and then what's going to happen for biosecurity once they return. We're going to have a post survey, like I said, go out to all exhibitors on some of this information. Hopefully we can collect some data to use on what they do when they get home. Other topics we cover in this plan are waste management during the fair. Where does that go? Is it all contained in one dumpster or one area? Trash. We have all the emergency contacts in this plan if an outbreak occurs. We also have a communication plan and a response plan. If we have an outbreak, what are we going to do at that time? Of course, we're going to rely on Florida Department of Ag, which we work closely here with in Alachua County and other fairs. And then we also have a cleaning and disinfectant list that will be used throughout the fair. So these are just a few of the signage that'll go up, and Colleen said we need to update this a little bit. So again, these we're using these from USDA, and so we can, as we go through this fair season, we'll find things that work and things that don't work, and we can adapt them to our areas here in Florida. So with that is our communication biosecurity plan for our fair, and we are the guinea pigs here in Alachua County, and we'll see how it goes. And I have Bradford County next week, which we probably won't use this plan as in depth, but we hope next year we'll have a really good plan to work with at all of our county fairs as well as the state fair. And as Colleen said, so far so good. We've been very successful with our fairs and all of our county fairs. So we will hopefully maintain that, but be ready. And I think that's just, as Colleen said, even on the dairies, we just need to be ready and ready with a plan and what's going to happen, because we don't want to get to that point where if we did have an outbreak, we don't know where to turn to. And again, I just want to thank FDACS. I know we've got a lot of FDACS folks on the Zoom webinar today that have really been beneficial in helping us with a lot of these biosecurity plans and helping us at fairs in general.
Great. Thank you very much, Cindy. Appreciate that. We have a couple of questions. I'm going to go ahead and put the slide up for all of our presenters. Ben did have to leave, but again, we want to thank them. This is the information for the evaluation that I mentioned in the chat. There are a couple of questions. I'm not sure if either one of you would want to take these specifically, or these are more Ben type questions, but there was also a question about, well, can you rewatch this webinar? Yes, this is going to be recorded. We'll send the link out to everyone who is on this call, as well as everyone who registered, but then please feel free to share that. We'll get that information out as well. There was a question here about the link to the biosecurity signs. Cindy, you, I guess, found those. If you can share that with me, I can share it with with everyone who's on the call today. I have all your email addresses. Absolutely. This other question is, it was mentioned that trash has been left on farms after personnel have visited, but that's actually a recommendation from the USDA. Regarding biosecurity, it sounds like this recommendation is not supported here.
Dr. Telg, I'll just make a comment on that. So I certainly am not advocating or not, kind of, I understand the reason for that, that if anything is from that farm, it should be left on the farm. It's just making those recommendations less of a problem for the farm to deal with. So if someone goes on farm, whether it is extension or FDAX or a vendor, having your disposable boots and your bag to wrap up your trash in and put in a trash can when you leave the farm, the actual sign showed them taking off gloves and having things on the ground next to their vehicle as they drove away, which just, we wouldn't do that if we visited someone's farm or house or anything else. So, just being respectful of the places that we visit, certainly following the recommendations to not be that vector of spreading the pathogens, but, just using some common sense when we're on facilities and having a plan to take our PPE supplies, following the farm's procedure, and then disposing of that stuff on farm in the appropriate location was really more of the the reason for mentioning that. There's also, I know that Cindy had several of the signs in that packet that will be coming out after these fairs. There's also some great signage available through the Secure Milk Supply website, and so we can maybe get some of those together that we can post after this.
Great, thank you. Well, I think we're really close to time. Do either of you have any last comments today after all the comments and questions presentation? Sorry about that. We do want to thank our presenters again. Ben had to check out a little bit earlier. Thank you, Cindy. Like I said, you've got a very busy fair next week and a half or so. Colleen, thank you for your comments as well. Please do know that this was recorded. We will be providing the link to this as soon as we can get those ready to go on our website. And we would really love to hear from you, those of you who are on the call today. And those of you who are watching this later on the recording, to hear your thoughts, your attitudes and opinions about what you have learned today about H5N1, specifically in this case also about biosecurities and protocols thereof. Again, I'm Ricky Taug, and we are glad that you were with us today. The Southeastern Coastal Center for Agricultural Health and Safety hosts these type of webinars on a regular basis. Please be on the lookout for more of these type of webinars in the future. And with that, again, have a great day. Thanks. All right. Webinar is over. Thank you both so much.
How many did we end up having?
We, including us, at one time we had up to 72 people. So
I missed one. I wrote down 71. Okay.
7. Yeah. So 60. Yes, I know you'll need that information, and I can share the attendee list and the registrant list too for y'all. I know you'll need it for annual stuff at the end of the year. So
What about the evaluation? It might not fit perfectly with how we report, but can you share that also?
absolutely.
Okay.
Thank you.
Yeah.
Thank you for
both.
doing this. Yeah,
Hey.
thank you. It's been a
Well,
lot here lately in the last couple of weeks.
well, one thought would be, after you've gone through this round with the biosecurity protocols, if you're both willing to do this, I know Ben would be happy to do that. Maybe April-ish or May, do this again and say, here's what we have learned about this and how we may be able to prepare this for the future, So
I think that's a great idea. We still have hopefully 3 dairy shows of some substantial size left with our Okeechobee County Fair, where we have not used that specific framework, but we've, just because the dairy farms are involved, we are, going to use some of that. So, and then we've got the, what we've learned from the other dairy shows, and we have the State 4-H Dairy Show and Miami-Dade that we take cows to in April. So we'll have even more that we know by the middle of April.
great. All right. Well, thank you both very much. Thank you for everyone. There are a few still on. We've paused the recording before this conversation started. So good. Have a great fair or fairs, Sydney.
Yes,
Sydney.
thank you.
Thank you all very much. Bye, everybody.
Thanks.
Bye.